Natural disasters are no strangers to the countries of the Latin American sub-region. In 1985 alone, we witnessed devastating earthquakes in Chile and Mexico. And the eruption of the Nevado del Ruiz volcano in Colombia. How well equipped were these countries, and others in this region, to face these sudden tragedies?
The rescue operation has been going on full-time for about a day and a half.
Some media have dramatized and nurtured the image of a helpless population and overwhelmed health authorities. But, in fact, most countries in Latin America have sophisticated and extensive health services and a relatively high physician-to-population ratio. Indeed, medical unemployment exists in some countries. Despite this, few countries alone can mobilize all the resources necessary to cope with a disaster. Often, they must rely on the international community during these trying times. International assistance can be a mixed blessing. It is crucial to helping a country get back on its feet, but when improperly directed, it can aggravate problems, contribute to chaos, and lead to a second disaster. Let's take a look at some of the effects of international assistance on the health services of disaster-stricken countries.
The cry for help from Colombia is being heeded in the United States.
As news of a major disaster spreads, a concerned public worldwide clamors for prompt action.
With thousands still missing, many Americans are anxiously watching and waiting.
In Guatemala, communications in almost all the central highland region had been knocked out. There was no way.
Here, the BBC observed that sending a field hospital is a classic example.
It is the traditional gift. It's good for the politicians of both donor and recipient governments. But is it what's needed?
When unsolicited medical relief is not attuned to specific requests, it competes for attention and space with other, more pressing needs. Thus, the health sector must divert personnel from other more important tasks to sort, classify, and label donated goods, the value of which is often questionable.
Antibiótico, ¿verdad, doctor? Sí. ¿Sí? ¿Y dónde van los antibióticos? Ahora sí ya. Vamos a editar para ahorita. Vámonos aquí. Aquí. Hola, querida de dos y de uno. Dos filas. Pero hay que cuánto se alcanza. Luis, Herman. ¡El COVID!
In many instances, improperly coordinated international assistance also causes bottlenecks at points of entry. And it arrives too late to have much of an impact in terms of saving lives. It is important to remember that the worth and relevance of international assistance depend on when it is available at the disaster site, not when it is pledged or sent. Successful cases of donations are the result of close consultation between relief agencies and the health authorities of the affected country. Well-coordinated donations have been valuable in many instances. Foreign medical personnel lacking specialized expertise and a knowledge of local language and culture place a similar burden on the healthcare system of a disaster-stricken country. They also arrive too late to be of any assistance in the immediate critical phase, the first 24 hours. But there are many positive examples of rapid and successful assistance in terms of personnel and equipment. Their common denominator seems to be a response to clearly identified needs, as outlined by relief or health authorities. Examples have included search and rescue expertise, logistics support, and technical assistance in highly sophisticated fields, such as secondary infection control or water supply management. Countries are becoming increasingly aware of these problems and are establishing criteria for controlling relief, inspecting and sometimes refusing aid regarded as irrelevant. They are also being more candid with well-intentioned donors about the worth of certain aid, thus breaking the vicious cycle of inappropriate international assistance. Emergency management by both the affected country and the international community is an exercise in decision-making under uncertain conditions. Managing information and assessing needs are the keys to effective disaster management. Countries must establish a system to quickly collect and disseminate information. Close consultation must be developed with national health authorities or international agencies charged with coordinating disaster relief. Although this may delay the arrival of aid, the time is well invested if the assistance effectively complements local resources. The balance between donor and recipient is a delicate one. International assistance in the face of disaster will always be needed to restore basic services and healthcare. This is especially true now, when many countries are facing economic crises and soaring foreign debts. And, at the same time, industrialized nations are carefully scrutinizing expenditures on international assistance. In the last few years, cooperation and communications between donors and recipients have improved dramatically. We must continue this trend, employing sound guidelines and criteria for emergency management to maximize the worth and effectiveness of international aid.